Hey, this is Brad Block, host of The Physician's Guide to Doctoring. This is a personal and professional development podcast for physicians where we have experts on the show that try to teach us everything we should have been learning while we were memorizing Krebs cycle. Welcome back to the podcast. You might notice that every episode I start with welcome. We've got a super special guest today. Today's guest is maybe a little less special, and you'll understand why in a moment. Okay, so Adam Block, familiar sounding name, is an associate professor of health policy at New York Medical College. He's also the founder and CEO of Charm Economics, a boutique health economics consulting firm where he develops economic models to support digital health companies, medical technology companies, and assist in estimating damages in legal cases. Prior to this, he's done a few different things. He was the director of strategic planning at Montefiore Medical Center in the Bronx. Before that, director of medical economics at Fidelis Care, the largest Medicaid plan in New York. And prior to that, he spent 5 years helping to write the Affordable Care Act and then was a regulator at CMS. He got his PhD at a college in Boston, some of you might be familiar with, but doesn't need to be named. And he regards himself as his mother's favorite child. The only episodes she ever listens to are the ones when he's on it. So maybe he's onto something there. Maybe our mother really does love him more. Welcome back to the show, Adam.
Thanks, Brett. Good to see you. Good to be back.
So today we're going to be talking about what we should expect from the next administration, right? And let's just get right down to it, right? So what's the core vision for Trump's healthcare policy?
So I don't think anybody knows. I was just at a healthcare organization conference in Central Florida, deep in the heart of Trump country, and I was talking to a lot of people about this. Many of those people are dependent upon the program, which started as a part of the Affordable Care Act. Many of those folks do not think that the Affordable Care Act is going to change or that these programs coming out of CMS are going to change. However, what we saw was that he appointed RFK Jr., who has some very strong feelings about a lot of things, as his HHS secretary. And so I had believed that there was not going to be much change in healthcare, which is what we experienced in 2016 when Trump won. But I'm not so sure nowadays. There may be a broad regulatory change that starts to happen as a result of this new team that he is putting together, including Dr. Oz heading CMS and the Johns Hopkins professor and vaccine skeptic, Marty Makary, as the head of the FDA.
So I do want to give us a little hope because during his first administration, Trump had put Jim Bridenstine, a climate denier, in charge of NASA. And after working at NASA, he actually changed his mind. And so working among all of those brilliant, dedicated scientists actually had an effect and changed. So there is a little hope in some of these vaccine denying people who are in charge of our healthcare system. A lot of it, we just don't know. We don't know because previously it looked like a lot of the stance was just trying to dismantle things that had been built by Obama, right? They tried so many times to take down the Affordable Care Act. So I think something that we can use, though, is like the Heritage Foundation's stances on healthcare, right? Because that might be something a little more predictable.
Sure. So the Heritage Foundation, in my experience, is like a consistent, very right-leaning think tank. And one of the things that they have been proposing for years is something called Medicaid block grants. And what Medicaid block grants are proposals that instead of giving an unlimited amount of funds to Medicaid, where it's just tied to however much the state decides to spend, take that chunk of money and cap it and give that amount to the states, so that states that have extremely generous programs like New York, like California, like many others, would basically not be able to spend in as broad of a way and cover whatever they wanted to, because basically the dollar amount would be capped. Now, the dollar amount right now is approximately 50-50 in most of those states. In other words, the states have to pay for 50 cents on the dollar of all the Medicaid spending. So the state is making a decision to be more generous in Medicaid, but they are also footing a decent portion of the bill.
For Medicaid, there were also the block grants, but weren't they trying to push work requirements previously as well?
Yes. So they did that in a couple of states. And so what work requirements really are is a requirement that says that a broad set of people has to show that they are either looking for work or basically are working. What this amounts to in reality is an additional paperwork burden for a paperwork heavy program. So what it amounts to is an ability for states that don't want to basically have a Medicaid bill that is as high as it is to push workers off of Medicaid through basically attrition because people just can't do all of that paperwork. Some of them can, but to show every month that you are either working or looking for work is really complicated. And it's not like it's the only thing that you're doing. You are doing all the other things that you have to be doing in your life. So that would be one of the first things that I would expect to happen. What you expect to see there is that states that expressed interest last time would potentially be signing on and trying to reduce their Medicaid rolls as a result of this program. Now, states aren't going to say that this is what the objective is. What they're going to say is that there's a whole bunch of people out there that are not working and that should be working if they're going to get this incredibly valuable benefit. And I will just say that Medicaid is an incredibly valuable benefit. It provides essentially free healthcare. It can be limited in many ways, but it's essentially free to a broad swath of people. But there is a very big paperwork burden already with it, and work requirements would just add to that paperwork burden.
Insurance companies with prior authorizations have proven that this is a great way to limit spending. Not great, effective way to limit spending. And so there's precedent here that just adding more paperwork to people is going to limit access and yeah, makes sense. So the Affordable Care Act, I do want to get back to that because White House Correspondents' Dinner, I don't know when it was in the Obama administration when Obama really went after Trump at the time and embarrassed him. And Trump being a birther, I'm not saying it wasn't appropriate, but you could see where Trump decided to run for president. And he's got this vendetta against Obama. And the Affordable Care Act being the hallmark of Obama's presidency, I could see where he's really going to be driven to try and dismantle it. Do you think that may happen?
So I don't think it will happen. However, if he wanted to, it would be a couple of phone calls, given that the Senate will be in Republican hands with a couple of votes to spare, and the House will be in Republican hands with a couple of votes to spare. And if we've seen anything, it is that Trump holds an influence over all of these folks in a way that virtually no other president has in recent memory. So I believe that if that is what the objective was, they would be successful in overturning it. However, what I will say is that I think the Affordable Care Act is relatively popular because it is offering care to a lot of people, including probably many people that voted for Trump and will continue to vote for Trump. And so, if all of a sudden those people find themselves uninsured, which could be, if it were overturned tomorrow, 20, 30, 35 million people, I think that would be pretty damaging. And so Trump has shown himself to be a politician, and this is what I believe is a popular policy. So it is not my expectation that it is going to be overturned in the way that was the objective in 2016. But now we've had a stable period in that market, and I would be surprised if that was a choice that the Trump administration made.
In a similar vein, a lot of Trump supporters are in rural community, right? And rural healthcare is in trouble, underfunded, understaffed. So, what proposals are there from that administration to improve healthcare access in rural areas?
So what I have seen, and in particular, what we are seeing is right over time is an Obama administration, then a Trump administration, then a Biden administration, then another Trump administration, right? So that's what we're going to see. I actually do not expect there to be enormous changes in that sort of in the insurance sphere. I would expect that some of the policies that were instituted possibly in the first Trump administration and maintained by Biden, perfect example of that is telemedicine, would maintain and stay the same over time. In other words, that they would just be retained by the previous administration. Another example of that is price transparency that started in the Obama administration, was maintained in the first Trump administration, was maintained in the Biden administration, and then I would expect it's going to continue forward. So there are just a lot of things, at least on the insurance side of healthcare, that I expect to be staying the course.
Okay. Speaking of staying the course. So, we had inflation, right? And during a period of pretty significant inflation, Medicare reimbursement decreased and continues to decrease. So, physicians aren't just making less because of that, but because relatively there's no inflation adjustment. So, Can we expect that to change under the next administration?
So I really don't know what Dr. Oz is going to that right. That's the organization that Dr. Oz is going to lead. Dr. Oz's experience is much more in the place of clinical medicine, as well as other programs like related to supplements and things like that, that are really focused on individualized health rather than payment policy. So I don't think anybody really knows what Dr. Oz's plan is going to be. I don't think anybody wants the doctors to be unhappy. I think that the Republican orthodoxy, of which I think Trump subscribes to this at least frequently in healthcare, is that private sector does it better than the public sector. And so what you've seen is that Medicare Advantage enrollment has gone up in the last 25 years, where it started at about 5%, is now at over 50%. I expect that to increase even further in the Trump administration because one thing that drives Medicare Advantage enrollment is whether the reimbursement rates for the Medicare Advantage plans are high or not. The Democratic administrations have been less keen on keeping Medicare Advantage high and have poured more money towards traditional Medicare, and Republican administrations have poured more money into Medicare Advantage programs. So I expect there to be more money going into those programs that could result in higher rates in the Medicare program. And so that's what I expect to be happening. And that will also result in potentially a broader set of benefits that might be out there. When I say broader set of benefits, Medicare is right now does not cover hearing aids, but there may be some Medicare Advantage plans that choose to elect to cover those benefits. And so that's something that could potentially happen.
You mentioned that he's a fan, the idea that the private sector does it better than the government, right? The government is known for inefficiency, and the private sector is known for just looking at after itself and not necessarily its constituents. That being said, the private sector can run things more efficiently. So give us some hope. What are some positives that might come from this administration?
I think that there's going to be increase in funding in Medicare Advantage. And so that's one of the things that could be coming from it. Another thing that might happen that I have heard just by listening to whispers of people that believe it is that there is a broad concern among both parties that pharmaceutical prices are too high and that the US is not leveraging its full power. And so it's possible that the Trump administration decides to take an active role in lowering pharmaceutical prices. Now, this wouldn't be unique, right? The Inflation Reduction Act, the Biden administration did that with 10 sample categories of drugs. So that's an area that could come in. However, quite honestly, that doesn't impact individuals. It impacts individuals on a day to day basis, right? Because before they hit their deductible, it impacts them dramatically. After they hit their deductible, assuming that they're insured, which something like 88, 89% of people are, then it doesn't really impact them after they hit their deductible.
But isn't his chief of staff a lobbyist who's worked for pharmaceutical companies? Doesn't she have a vested interest in protecting them to some degree?
You can view this two different ways. The previous HHS secretary, Alex Azar, was a pharmaceutical executive for Eli Lilly. One way to view it is that they are going back to their industry and they are loyal to the industry that they've been a part of. Another way to view this is that this is the opportunity of their lifetime, and they're going to do the most to make the most of the moment that they have. And everything else subsequent to their career will be built off of what they have done at this moment, assuming that they
Yeah.
stay in office for more than a few weeks, which some of the people in the past have been known to only stay for a few weeks.
Yes. Our high school is known for certain graduate, a Anthony Scaramucci. So I think a Scaramucci is a unit of measurement that lasts 10 days. Is that
10
am I
days.
remember that? 10
Yes.
days. One Scaramucci is 10 days. Yes. Yeah, but that's an excellent point, right? You have your pre-administration career and then your post-administration career, and those can be two very dramatically different things. Your value and understanding how things work and your influence after can change dramatically. So there is hope there. It
I
might
do not believe
not
that
have the same
people
level.
are always married to the industry that they have been a part of
Yeah.
for, and it depends on what their career looks like. So it can really depend.
So for the listeners, if you suffer from anxiety, the interview is going to get a little dark now. Bear that in mind because I want to bring up the bird flu pandemic. That hasn't started, okay? But considering how the previous administration reacted, a lot of his cabinet, Martin Kari, Jay Chira, tried to downplay a lot with the COVID pandemic. In fact, I think it was Scott Atlas that was quoted as saying, let them get infected because they were trying to get to herd immunity to get the economy back up and running. And actually, for the listeners, if you want to listen to an interview with Jonathan Howard, we did it probably about a year ago. That was their plan. So the avian flu has a 53%, and I believe it's the CDC that keeps an eye on that, identifying cases. Do you foresee the Trump administration handling a new pandemic in light of how they handled a previous one?
I don't expect there to be a new pandemic. The only pandemic, like we've lived through one major pandemic, and the only pandemic that was even remotely close to COVID was the Spanish flu of 1918. So I stick to history on this and think that this is a once in a hundred year. And every so often you hear about different things coming up, but I really do not expect there to be another major pandemic that a new Trump administration would have to deal with. That said, I think that we would expect to see it dealt with in the way that many of the folks would have wanted the first pandemic to be dealt with, which is we just have to ride this out and to go to work and try to adjust our policies so that we try not to get sick, but not to disrupt life as much as it was disrupted in the initial pandemic. And there was some overcorrection that happened in the initial pandemic that the Democratic administration wants to really talk about. It's been my concern that the CDC never really did a analysis of what went right and what went wrong. There are a lot of things that went right, and there were a lot of things that went wrong.
That being said, public health done right can look like an overreaction, right? Let's say we had locked down for one more week and COVID just went away, right? We'll never know that. And it's not something that is realistic to expect. But at the same time, like if there were stricter measures and COVID then just evaporated, that would look like an overreaction. So to push back on that, public health done right can look like an overreaction. That being said, I think what you're mentioning is like lockdowns in cities with very low cases, right? Like you lock down a city where cases are trending up, understandable. But to have the initial lockdown where the whole country locked down in times where there weren't many cases in those cities, I can see second guessing decision like that.
Yeah. In short, I'm not worried about this happening again. It's not something that keeps me up at night because it has happened so rarely in world history in the past. It's something that happens once every century. That doesn't mean it will not happen again. But some of the strength of what happened was that we found vaccines in 10 months, right? COVID was discovered in December, approximately December of 2019. And there were shots in arms in December of 2020.
Which brings us to the head of the Health and Human Services, RFK Jr., a vaccine denier, arguably responsible for the death of over 80 children in Samoa. And he had gone there and pushed against vaccines. And after two children had died because they were given the wrong medication, they were given, I think, I don't recall exactly what they were given, but unfortunately, two children were given vaccines at the same time as another medication that killed them. And he pushed that as this is what happens when you vaccinate. That led to a measles outbreak that killed over 80 children in Samoa. And this is going to be the guy in charge of HSS, right? A vaccine denier. So before we get to that, give us something to be hopeful about for him as the head of HHS.
So I don't think he has the ability at the outset to basically overturn any of the FDA's decisions. The FDA first operates as an independent agency, and he is running the entire organization, but not that agency. But I believe that once drugs are proven safe and effective, that they remain being safe and effective. So I'm not worried about drugs that have come out, vaccines that have come out, going away or becoming unavailable anytime soon. But there has been a shift in both the public and also some higher levels of political people away from the efficacy of vaccines. In other words, they no longer believe in the efficacy of vaccines. Personally, my read of the evidence is that's just completely mistaken. That vaccines have done more for public health over the last 200 years than virtually anything else other than potentially clean water. And I don't expect there to be as much. The shift I think that we'll see is invisible, which is that public funding that has funded that research will probably shift more towards treatment of disease and away from vaccination as a method of reducing disease burden.
But I thought his whole thing was prevention of disease, not treatment of disease, right? Like healthier living. Is that something that an agenda that he'll be able to move being the head of HHS? Because that seems
I
like it would
mean,
come from,
yes, but most of the things that go into prevention of disease are nothing that's going to hurt anybody, right? It's
yeah,
exercise more, eat better, which I don't think anybody on
yeah.
anywhere is going to oppose. I mean,
No. In fact, Michelle Obama tried that.
ex-
No, Michelle Obama tried that, right? She tried to get people to eat better and move more, and then she was the food police. But when RFK does it, oh, well, he's really looking out for us, right?
he
This
hasn't done it yet. Let's see what happens with him, right?
yeah,
So there is a honeymoon period and we are in it, but no policies have started yet. And we saw the backlash against Mayor Bloomberg when he tried to ban sodas of a certain size. And we saw backlash on both the right and the left. I remember on The Daily Show, Jon Stewart drinking a giant soda in the middle of New York City just because he could.
yeah, yeah, or taxes on certain sugary beverages or something like that. Yeah, this has been discussed before, and the public has never gone for it.
Yeah, I
So I
could
think
tell you all about I worked on some sugary beverage taxes before. I've read about them. We saw them open up in Philadelphia. There was a decent sized tax in Philadelphia in 2017, raised a bunch of money, and there was a big JAMA paper all about it. And it reduced at least the sale of soda in the city of Philadelphia by about 50%. Yet, and it of course raised money. What happened was it got overturned because it was super unpopular. And this was what I would call like a meaningful tax. This wasn't like a penny on a soda. This was like 30 cents on a can of soda and 90 cents or $1 on a 2-liter bottle. So it was like financially meaningful.
yeah, and then the pushback against that has always also been like the ethics of it, because who does it hurt the most? It hurts the most with the least. Rich people are not going to sneeze at that kind of money. But if you're struggling, this is going to be a significant amount to you. It's the same with taxing cigarettes, right? Who tends to smoke the most? Those of the lowest economic means. And so there's an ethical consideration. In fact, with cigarettes, that was the only thing that ever been proven to decrease cigarette smoking. All these campaigns, I went to a high school and was talking to a bunch of kids about smoking, and I knew it was useless. The only thing that helped was raising the price. But yeah, so I guess that's a good point. They can try and they can talk about it, but can they actually implement it without a lot of backlash? Yeah. I guess history speaks for itself.
Expectation is that they will be able to implement many things because those
Yeah.
Republicans have the House of Representatives, the Senate. They feel that there is a mandate. You're bringing in not middle of the road folks to lead all of these agencies. So I expect there to be quite a bit of both legislative and regulatory activity that happens in the first 6 months to a year. One thing that's important to remember is that the election cycle is relatively short, right? Trump will be inaugurated in January, right? Late January of 2025. And the midterm elections they'll all be primaries for the midterm elections, just a shade over a year after that. So, like 16, 17 months after that. So, that's really the window because what you have seen in virtually every change of administration is that immediately after that change of administration and when the House takes power, that the House swings back the other way. And so I would expect, and nobody's stupid, both sides know this, right? They all know that they have a limited amount of time to act on this. So I expect a flurry of activity relatively quickly because while Trump's term is 4 years, the honeymoon is really only about 18 months.
Well, I don't know. I don't know because there's all this speak of a blue wave and a blue wave and a blue wave, and it never seems to come. The pushback against it hasn't been as strong as some people have thought it would be. So he might end up with more time than those 18 months where, but
Oh,
historically.
absolutely. But what we've seen in the last 10 to 15 years is that the presidency has swung back and forth. And we have seen that the House has swung back and forth almost every 4 years. And so it would not be unreasonable for the administration to believe that might be coming. And so to rush any of its material that it wants to move immediately while it has the maximum day of political capital is January 20th, 2025. And
Yeah.
so there's going to be a bunch of stuff that is happening soon after that. That's what I would expect to happen. Obama, right, took his sweet time to think about things and legislate slowly. And that was a concerted strategy. This doesn't seem like that type of administration to me.
Put politically, if people want to find you because you are the CEO of Charm Economics and you develop economic models to support digital health companies, medical technology companies, and estimating damages, legal cases. So there are a lot of entrepreneurs that listen to the show. And so if they want to look into you and your services, where do they find you?
Charmeconomics.com.
Adam Block, thank you so much for your time. And I'm the favorite. Thanks for listening. So please share it or like it or comment on a social media post or write us a 5-star review. Thank us again for listening to The Physician's Guide to Doctoring.